we will be talking about anti-seizure drugs. So everybody probably knows what a seizure is. You can have a febrile seizure, or you can actually be diagnosed with epilepsy, which basically what a seizure is abnormal electrical discharges from brain neurons. So remember, we have our nervous system neurons, so it's abnormal electrical discharges. There's different types of seizures, which we're going to learn about. But signs and symptoms of seizures are muscle weakness, confusion, drowsiness, hallucinations, mumbling. They have anxiety or emotional issues. And there's like a prodromal period where some people know that a seizure is coming on, some people don't at all. And then you have the seizure, and then you're post-ictal afterwards, meaning you're just like really out of it and really tired, maybe still a little bit confused, weak, and that kind of stuff. So there are many types of seizures, but these are the most common types of seizures. So there's tonic-clonic and petit mal seizures. So tonic-clonic grand mal seizures is the most common. So that's when, what we typically think of seizures, them jerking, and that can be really dangerous. And then there's the absence, where they have a brief loss of consciousness, 10 seconds or less. Usually it's in children, but not necessarily in children either, but it is more common. So absence, sometimes you don't even realize it. I had a patient that I diagnosed with absence seizures because he told me that he drove to Milwaukee and doesn't even remember going there. So that's kind of scary. There's also a common partial seizure type where they have more psychomotor stuff like behavioral changes, repetitive behavior, chewing and swallowing. So it's a different type of seizure. So there's a lot of anti-seizure drugs, or I should say they've done a lot of testing and experimentation with drugs that can help with seizures. So these are just such a few of them. We're just going to go over the most common ones here, but as you can see, and Keppra is actually the one that a lot of people are on now. Let me see which one that is on here. I don't even see it on here actually. So, but just, this is a nerve, and how there's different receptor sites. It looks a little bit of a complicated picture, but the whole point is to tell you that each of these drugs work in a different way with the nerve to try to get things back on track again. So I'm sure you've heard of Dilantin before. That's the Phenytoin. And these drugs, remember, they have a narrow therapeutic index, so you need to get Dilantin levels to make sure that that it's fine in the bloodstream, but there are some adverse effects. So that middle picture there is that Stevens-Johnson syndrome, which can be deadly. There's a glove syndrome, where it looks like the baby has a glove on over here, and then you can get gum issues with it also. But a lot of people take it and don't have those issues either. They also have some increased effects with other drugs, decreased effects with some drugs, as well as anticoagulants, oral contraceptives. So it is not a benign drug, and you have to be careful with it and make sure that you're monitoring them, and also know what kind of other medications that they're on. So this is probably going to be a drug that you would need to look up probably almost every time, unless you really get all this stuff memorized in your head. Obviously, it's a health history. You want to make sure that their liver function is fine and their renal function, because then you'd have to maybe choose a different medication or make an adjustment on the dose. And as far as nursing diagnosis, it will relate to what the side effects are, or adverse effects. So risk for injury and falls. And also they have seizure disorders, so they're definitely at risk for injury and falls. You want you want the patient's seizure frequency to diminish or lessen extensively. So as I said before, the nursing interventions, you're going to monitor the drug levels. So it's just a blood test, and it's called a Dilantin level. And you talk about if they're female patients of childbearing age, you want to you're going to talk to them about contraceptive methods. Use additional methods, not just the birth control pill. Seizure precautions, and make sure that they're not driving. If they do have epilepsy, they're not really supposed to drive. But if they're starting any medications, then they should see how it affects them first before they take it. Barbiturates, this is another one but can make you so tired. Phenobarbital, it's rarely used anymore, but it can be used for mixed seizures, all different types of seizures. This is another narrow therapeutic index drug, so you need to make sure that you check it. Succinimide, that is an old drug. As you can see here, it can grow hair, and its action has to do with the calcium influx with the neuron. There's so many different things going on with intake and output of different chemicals and enzymes, etc. So this is just one thing where it works with the calcium. These are used for absence seizures. And again, it needs to be checked in the blood to make sure that the level's where it's supposed to be. Now, these are benzodiazepines. This has been brought up before: clonazepam, clorazepate, and diazepam. Clorazepate, so clonazepam is Klonopin, clorazepate is Transine, and diazepam is Valium. So not only are these used for other things that we've talked about already, it's also used for epilepsy. The clorazepate can treat partial seizures, and the diazepam status epilepticus, and those are like ongoing seizures, so you basically will give some Valium, which is very commonly used in the hospital. This is carbamazepine, and this is also used, I still see this used. This is for partial seizures, tonic-clonic, so they're also used in psychiatric disorder. That's probably where I see it used most, is psychiatric disorders, like bipolar is one of them. Trigeminal neuralgia is actually, you have your fifth cranial nerve is your runs, actually, it's all comes from your brainstem, but it supplies to the nerve or feeling to your face. Think of it going on your cheek all the way to your jawline, through your jawline. Trigeminal neuralgia is very painful, where it's just not firing correctly, the nerve impulses, so you get tremendous shooting pain in your face. And so carbamazepine is used for that. Sometimes alcohol withdrawal. And there's side effects, possible interaction with grape juice. Now, this is your Depakote, which we have a lot of people on for seizures, as well as elderly people are on this also, for psychiatric disorders, younger people too. It's used for tonic-clonic absence and mixed seizures. You have to check the range and make sure that's okay. Sometimes they can get suicidal thoughts and be really depressed, want to sleep a lot, so you have to watch patients that are on that, because it kind of like calms you down, basically. It not only helps the excitability with the neurons in your brain, it also helps calm you down, but sometimes you can get depressed with it. So anti-seizure drugs in pregnancy. So seizure episodes increase 25% in women with epilepsy who are pregnant. So you have to be really watch these pregnant women. Some actually are okay with it, but many of them are teratogenic, and so we really just try to watch and not put them on any medications during pregnancy, because we don't want anything to cause malformations with the fetus growing. They also increase your loss of folic acid, and so they would probably need to take more folic acid, but you try not to give them any medications if possible. You can have a febrile seizure. It's usually babies, young kids that have that. It's about 2.5% of children have had one or more febrile seizures. It's scary. That's why if your child has a high fever, you should not put them in cold water. Some people think cold water, ice, but no, it's really supposed to be just like a very tepid, lukewarm, because you don't want to bring the fever down super fast, because then that can actually provoke a seizure also. High-risk patients, Valium or phenobarbital is used for treatment. Status epilepticus, where they just can't come out of a seizure over and over. It's a medical emergency. That's when you give all the IV medications. You're giving the Phenytoin IV or Dilantin, diazepam or lorazepam, remember the PAMs, and you don't want to give both, but you give one or the other. And that's it.